I will share the link on the COD group.
We are live on YouTube.
Great. Awesome. I will share the link on COD group.
Yes, you can share the link and to everyone. Yeah.
Sure. Thanks. I'll share after 2 minutes, है ना, ताकि let it start. नहीं तो लोग फिर turn off हो जाएंगे. They don't see anything, they will turn off. Share the link on COD group. Huh?
Yes, you can share the link.
No, I'm not sharing the link with the on the COD group because लोग ये होते हैं ना. अच्छा, sorry.
Dr. Annas, you can begin. Dr. Annas, unmute yourself.
Hello, everyone. A warm welcome to one and all. This live session is in collaboration with One Place Sports. At Aqua we have worked closely with various sports persons. Our expert team of physiotherapists have extensive experience in field of sports physiotherapy. It takes me immense pleasure to introduce our speaker, Dr. Nikita Vaidya. Dr. Nikita Vaidya has done her master's in musculoskeletal physiotherapy. She has a certificate in manual therapy and clinical neurodynamics. She has worked as an on-field physiotherapist for Khelo India 2019, Pune International Marathon, and Oxfam Trail Walk. She is also a certified aquatic physiotherapist. Now I please request Dr. Nikita to take over.
Thank you, Dr. Annas. So, hello everyone, and today's topic of second lecture of series is common injuries in racket sports. Now, as we all know that badminton, tennis, and squash, these are the most popular racket sports game in Asia, right? Now, when badminton gained its entry in Olympics 1992, after that, the number of players, the awareness towards the sports had tremendously increased. Now, badminton is played across multiple age groups, and there are millions of people who are participating in this sports. Tennis had emerged from other racket sports like badminton and stuff like that, and it was recognized as lawn tennis around 1824 in England, and squash has been played since 19th century in England. However, in past few decades, the commercialization and advancement of these sports has led to the importance of performance enhancement, right? So, when I talk about performance enhancement, it necessarily also means that awareness towards the injuries and the prevention and management of injuries has become very important. Okay, so let us have a gist of what these sports look like. So here you have the most popularly played tennis. I want you all to kindly observe the movements, the shots that are being taken, the position of the player, because that's going to be an important highlight later of our lecture. Here comes the squash. Yeah. And the badminton. Right? So as I said previously, the advancement in commercialization of these sports, it has led to performance enhancement. Now the attention is very well directed towards the biomechanical aspects of these sports, the stance that you take, the footwear that you wear, the grip that you have, because many of our injuries, many of our management and preventive strategies of the injuries also include these things. So first step towards managing injury is understanding its risk factors, understanding its mechanism. All right. So today we'll just run across the common injuries in these sports, the ways to prevent and manage them. We'll see how holistic rehabilitation will come into the picture. Now, what are the common injuries that you see in these sports, right? Okay. So as you see in badminton, ankle, Achilles tendon, knee, then comes your upper extremity, right? So surprisingly, in racket sports, majority of your injuries take place in the lower segment of your body. And then comes your upper segment. So we might think that it's a racket sports, there must be prevailing injuries in upper limb. No, it's first that your lower limb injuries come into picture majoritively, then comes your back, and then comes your upper limb. Also, there are a few traumatic injuries. We'll see them. Now, if you see in badminton, it involves vigorous movements The stop and go mechanism. It involves running from one place to another, multiple lunges, multiple squats, jumping, overhead activities. So, the kind of injury pattern is prevalent in lower limb considering the amount of use, considering the amount of agility, considering the amount of impact that has come on the joints. Similar way, if you see an overall percentage in tennis also, your 50 to 60% of your injuries are in your lower limb and around 42% are in your upper limb, and rest come from the traumatic injury to the eye. It can be a head injury, it can be a traumatic dislocation. So acute trauma can be anywhere. However, prevailing injuries are in your lower quadrant. So here you see the incidence of your lower limb injuries in racket sports, with badminton being the highest. Ankle sprain being the dominant injury of lower limb in badminton, ligament injury in tennis and squash. Now let's see, as you know that badminton, it is a non-contact sport. So it is considered as a relatively safe sport because you don't kind of have an impact or contact with other people like in other sports, right? However, here involves a lot of agility movements, a lot of stop and go mechanism, a lot of lunges, a lot of jumps, right? Because of which the tendency towards your overuse injury is increasing. Okay, we'll understand what is overuse injuries in the coming mechanism. I want you all to carefully observe the repetitive movements of the limb and the kind of play badminton is. Yes, so this is just a highlight of what I said previously. 58 to 76% in lower limb, 19 to 32% in upper limb, and 11 to 16% in the back. And we'll understand why back and your core is one of the most important segment in any racket sport. Okay, now when you just see, first we'll focus on badminton. Now this is your forehand serve, and on the other side is your backhand serve. Okay, I want you all to carefully observe the mechanism that has been taking place here. So whenever there's a serve, when I'm serving forward hand serve, usually the muscles on my anterior aspect of the body are more prone to work. When I'm doing the backhand serve, it's your posterior chain that has been acting more. However, in badminton, because the weight of the shuttle is not so much, there's a good amount of force that you can give. However, your grip, your stance, and your biomechanics is important to understand the mechanism of this sport, right? Now, I want you all to see just the basic biomechanics of our badminton shot. Now, what happens? There's a preparation phase. Preparation phase is now when I'm rotating my body, I'm taking a stance in a way that now I'm supposed to generate a force in order to come to a contact phase, right? So now here, basically, my shoulder is in abduction, external rotation. I need to stabilize my scapula, my core, my lower limb very well so that there is an effective force generation. Then comes your phase of acceleration when I'm actually accelerating. Then I'll contact the shuttle, and now the shuttle is into other court, but however, I've followed through now. That is, my movement is still taking place, but the shuttle is gone. Understanding these biomechanics is very important in order to tackle injuries. You need a sufficient core. Now, usually, be it badminton, be it tennis, there's a lot of energy. There's something called as an energy transmission mechanism. So when I'm taking stance, when I'm supposed to contact the shuttle, my energy comes from lower limb first. The core, that is my middle segment of the body, that is over here, will transmit this energy to the upper limb, and that is how the adequate force can be generated to hit the shuttle. This is more in your tennis because the ball is heavy, the racket is heavy, and you really need to hit far, right? However, in both these sports, it's important that you have a strong core, a stable lower limb segment, because that's going to be your source for force generation. Right? So we'll just in this slow-mo, we'll just carefully see all the phases of your badminton shots. So there's a good stance, the energy generation, core has transmitted it to the upper limb, and there she goes. And follow through is still the continuation of the movement. Now, once you understand this, let us just check the common injuries in management in badminton. First is your overuse injury. Now, what do I mean by overuse injury? See, in badminton, you usually have your overhead movements. Mostly you have your overhead movements, right? So, near your shoulder, there's an arc under your shoulder. And below that bony arc, there are a lot of muscles that pass. Those are your power muscles, right? So when I'm kind of elevating it, I'm reducing the space of that arc. So there's a constant friction. However, to protect that tendons against the gliding of bone, you have a soft bursa over there, like a jelly-like substance, who protects it from impacting. But because of repetitive overhead movements, that also tends to get degenerated. Now, when I mean by upper limb overhead movement, most important is your shoulder blade. I assume that all of you all know shoulder blade is over here. That's your scapula. When I'm doing your overhead movements, if I do not have a stable scapular support, my hand is going to go overboard. There is a lot of force that is unnecessarily going to come on structures that are actually not supposed to take the force. It was a function of scapula. So, you kind of get prone to early injuries. Also, one important thing, majority of the athletes are seen to continue playing in spite of shoulder pain. See, if you have shoulder pain, kindly respect the injury, go to your surgeon, go to your rehabilitation specialist, go to your physiotherapist, and get yourself physically assessed. Get yourself assessed for your scapula, for your strength, for your mobility, for your flexibility, for your neuromuscular function. What I mean, this is to all the physiotherapists also, that lack of neuromuscular training. What I mean by neuromuscular training is your nervous system connecting to your musculoskeletal system. When I'm supposed to do a movement, if I need to understand, my brain needs to understand that, okay, now the shuttle is coming. How am I supposed to move? What my stance should be? How much the force has to be generated? So these kind of activities need to take place in your brain, and then it is conveyed to your musculoskeletal system, and then the movement takes place. So this connect is very important. And neuromuscular training, your postural, your balance training, lack of this training is seen, and which is leading to a lot of recurrent injuries. Now, talking about shoulder pain, right? So many badminton athletes, as I said, you see a lot of impingement that has been occurring. Now, what I mean by impingement, if you just clearly see in this picture, these are the tendons that are kind of impacting the bone because the bursa has got degenerated. There is a lot of faulty mechanics in the overhead mechanism, which then leads to the shoulder pain. Shoulder pain can vary from many things. Mostly impingement is seen. Okay. Now, if the player continues to play, there's definitely going to be reduction in the quality of life. So repetitive strain injuries are one of the most prevalent injuries that you see in racket sports. Then comes your tennis elbow and your golfer's elbow. What I mean by that is, see, when there's a group of extensor muscles that come from this part of your elbow, and they kind of get inserted at the wrist. So when I'm doing a repetitive action at the wrist, there's a lot of gliding taking place over the bone, a lot of friction taking place over the bone, and it kind of irritates that bone. So when it's lateral epicondylitis. When it's medial epicondylitis. It's always good to generate the force from your torso, from your shoulder, because those muscles are really strong to sustain that. When for a larger shot, for a larger impact shot, I'm constantly using wrist muscles, That's going to make me prone to lateral epicondylitis. Hence, usually your recreational athletes are seen to be at higher risk of these repetitive strain injuries than your athletes because of faulty mechanics. So you need to understand where to generate the force from and not do the movement in an altered pattern. When you talk about lower limb injuries, you can see that this is your Achilles tendon, that is your calf tendon. So usually when it gets overstretched, it gets overstrained, it leads to either a pain, strain, or rupture, right? Then is your ACL. Now your anterior cruciate ligament is very important to maintain the stability of your leg. Okay, so this is my thigh, this is my lower leg. Okay, there's an ACL in between these. So if my leg is going like this, lower leg is going like this ACL provides a constraint to that, which kind of adds to stability of your joint. Once this ACL is ruptured and my knees start going to giving way, and ACL injuries take a longer time to heal. Lateral ankle sprain. Now, ankle sprain is the most common injury seen in badminton. If you can see this gentleman sprained his ankle very badly, right? Okay, so over and all, what are the causes? A gist of what are the causes of your overuse badminton injuries. Lack of optimal warm-up and cool down. See, what I mean by I have decided today that I'm going to play badminton. So I go on the court, I lift one dumbbell and that's about it. No, that's not how warm-up is. Warm-up and cool down have a specific target, have a specified period, and that period has to be dedicated to warm-up and the cool down. Warm-up is going to elevate your body mechanism, it's going to prepare you for the sports that you're playing. And now once you're playing sports, all your vitals are high, all your parameters are high. So cool down will help to slowly get these parameters to baseline. And you have to respect that time. You have to give that much time for warm up and cool down. Then your external factors, what I spoke about, are your surfaces, your shoes, your grip, your stance. Then comes your muscular imbalance. Again, as I said, lack of strength, and you still continue to play. No, if you understand that there's a lack of strength, please take time to train it. Please give importance to endurance and then go to the sports. Otherwise, you're going to land up loading your joint for no reason. Again, faulty technique and skill. Yeah, usually seen in recreational athletes that there's an improper stance, there is improper hand placement, using a lot of your distal muscles rather than generating the force from your body. And all these factors lead to kind of repetitive stress on your joints and inadequate training. Surprisingly, in badminton, these injuries, they were seen at the end of training season than the beginning. So then it was hypothesized that because of this extensive training, see, you need to respect something called as recovery. I have trained my athlete, today I have worked out well. There's going to be a day when I'm supposed to rest it out, when I'm supposed to recover everything that is lost, right? And if you're a badminton athlete or a tennis athlete, it is also important for you as a recreation to play some other sport in middle. Okay, that is said to give an added advantage. Let's check the mechanism of injury. So if you carefully see after this, yeah, I'll just pause it here. Yes. Now here is the place where his calf tendon, his tendon Achilles was extensively in stretch, and then he has landed up in severe pain. Yeah. Again, here comes your technique. Your knee injury. See, when it comes to these injuries, I'll come to it. Your on-field assessment is very important. We'll talk about it in the management. Now we'll come a bit towards tennis. Okay. Now understand the racket of the tennis is going to be heavy. the amount of impact on your joints is going to be much more as compared to badminton. So as I said previously, if you see this athlete hitting the ball, okay, there's a lot of force first that you have to generate from your lower limb. Your core will transmit it to the upper limb, and there is the impact. Okay, so your core is very, very, very important middle segment that is important to translate these forces to upper limb. Okay, now focus on core and scapula. Understand the importance of your scapula. Scapula, your shoulder blade, small bone, small muscle attachment. But if these muscles are not trained properly, trust me, that's going to be really bad for shoulder. Yes, at the same time, your core stability is of utmost priority because you don't want to load so much taking momentum of your upper limb that there's no force creation from your lower limb and core. So we'll see the importance in our coming slides. Again, when you talk about, now here it will be much better to appreciate that when I'm doing my forehand stroke, okay, my muscles on the anterior aspect of the body are going to act more. When I'm doing a backhand stroke, the muscles on the posterior aspect of the body are going to act more. Please remember something called as a kinetic chain. Okay, your body is connected through fascia from your head to your toe. Any alteration in any of the body segment is going to show result somewhere else. Okay, now usually in backhand you see more of your wrist injuries also, right? Because sometimes when you use both your hands for your backhand, you tend to kind of click, you tend to kind of snap it, so your wrist injuries are more seen in your backhand strokes. Again, a gist of distribution: 50% injuries of your lower limb, right? 42 in upper limb, and then comes, you cannot ignore your traumatic injuries. There can be a head injury, there can be an eye injury, which are really bad. Now, if you see, the incidence is 0.05 to 2.9 per player per year, with men slightly more than females, right? Now in tennis, it's again upper extremity more than lower extremity. And what do you see? What kind of injuries do you see in lower extremity are your ankle sprains, usually your thigh strains, your hip bursitis, your Achilles. So these are the common injuries that are seen. Okay. Now, what are the risk factors that increase these chances of injuries? Again, similar to badminton, your improper warm-up and cool down, and inadequate technique. See, when I'm supposed to give a power stroke, it makes sense for me to have a wider stance, to have a proper grip. Grip techniques are really important when it comes to badminton and tennis. So all your professional athletes, please focus on your grip, on your stance, on your kind of footwear. Footwear and plantar pressures. Plantar pressures are the pressures given by your foot. Okay, when you're running, when you're jumping, there are a lot of forces coming from the ground. So the shock absorption capacity should be excellent, right? Overtired practice. Again, as I said, respect the fact that you have to have a recovery, you have to have a rest day, right? Previous injuries. I want everyone to understand the fact that previous injuries are a major risk factors for recurrence of injuries, especially in ankle sprains. Once you have a bad ankle sprain, please understand the importance. All the physiotherapists out there, we should understand that. Include your neuromuscular training right in stage 1. You don't want the brain to kind of forget how the movement of ankle is, where the ligaments are placed, how are they supposed to move, and ankle injuries are highest prone for recurrence, and it's really troublesome for athletes. So ankle rehabilitation is very important. So it's the summary of the types of tennis injury. Now, we should understand that injury can happen anywhere, right? From your skin to your muscle, to your ligament, to your bursa, to your tendon, to your bone, anywhere. So you have to be utmost careful. You have to be cautious. Now let's see. Now, what do I mean by holistic rehabilitation, right? Holistic rehabilitation means an overall perspective towards rehabilitation, right? So it's the combination of your aquatic, your land, and your outdoor training, which you will see now. I would like to take a minute for this slide. Now, prevention, again, as I said, the factors that cause risk, that cause injuries are itself the factors, the first step towards its prevention, right? So these are the things that we have already discussed about correct technique, your adequate warm up and cool down, prioritizing strength and endurance according to the target muscles. So what I mean by that, for example, as I said, consider that there are few muscles, especially your scapular muscles, that are supposed, so your scapular muscles that are around the scapula, their function is to kind of check the overboard movement of scapula that is taking place. When I mean by check, what I mean is the function of the muscle is to hold the bone, is to sustain the contraction for a longer period of time so that the power muscles of the shoulder function carefully. So focus on your scapular endurance, focus on the endurance training of the muscle also. Muscle is just not about strength. Your endurance, that is the capacity to sustain the contraction for a longer period of time, has to be respected. Okay? Respecting the injury and allowing it to heal. Every tissue in your body, be it a ligament, be it a muscle, be it a bone, be it your skin, every tissue has a designated time of healing. And that is your body's mechanism that is trying to heal the injury. So you have to respect that phase, you have to respect that period and plan your rehabilitation according to the healing. You need to understand that in acute phase, there's hematoma, it's resolving, there are new cells coming up, there is alignment of fibers that is happening. Then comes your remodeling. When in your remodeling, initially you have a crisscross alignment, you kind of need to have a stationary, properly aligned muscle fibers, and you need to respect that. You need to respect the fact that phases of healing and your rehabilitation should go hand in hand. Proper justice to rehabilitation. If your therapist says that you require this much time to heal, you require these many days to go back to sports, please respect that and don't start playing in middle. Now, quick on-field assessment. When you are on field, let's focus on the middle column because this is something really important. Just because you have those tapes in your hand shouldn't mean you should go and start taping. No, wait. For the injury has happened, consider a shoulder injury. Suddenly there is a fall, there's an injury that has happened, pain is 9 on 10, stop there, do a prompt assessment. That it can be a dislocation, it can be a strain, it can be a fracture. You need to promptly understand what it is. You need to arrange for certain splints or certain immobilization strategies if in such case scenarios, right? So the pain is 9 on 10. Athlete is saying that, oh my God, I'm having a lot of pain because of which I'm not even able to move my shoulder. It can be a dislocation. If the athlete says there's a lot of pain, but I'm able to move my shoulder, it can be a soft tissue injury. But there is a lot of swelling, there's a lot of pain, unable to move because of pain and swelling, there's a chance of fracture. You have to tell the athlete, wait, we have to call the emergency service and you have to go straight to the hospital. Make sure that you immobilize in a proper position. Okay, it's you all know that usually you do it in adduction, internal rotation, but there are multiple positions. So splint it and immobilize it in a position of relief. Okay, please make sure that assessment is really important. You need to, if there's a grade 2, grade 3 sprain, a stress fracture, you need to tell your athlete that I'm sorry, you cannot play right now. Your life, your quality of life is much more important. Game can happen later, but kindly stop. We now need to work on it. Okay, so it's how responsibly you tackle these injuries on field gives you one of the major outcomes in long-term rehabilitation. Now, after the injury, now we are managing any kind of injury, you should have an overall perspective towards rehabilitation. I'm going to come to it. Functional training. See, whatever rehabilitation you do ultimately has to be translated into the function. Ultimately, the person has his designated goals and your rehabilitation should translate into that. So functional training should be a priority right from day one. Coming to sports specific training. After your rehabilitation is done, the person is now supposed to go in the designated environment to play his or her sport. So that is your sports specific training. There are a battery of tests universally available that you're supposed to run. Make sure that when you're rehabilitating the athlete, you're constantly giving an update. There's a symbiotic relation between the orthopedic surgeon and you. You are supposed to manage the athlete as a team. It's never a one-man army, never a one-man's game. It should be in conjunction with the team, right? Then comes incorporation of neuromuscular training, as I said previously. Assessment and reassessment. Please do. When I talk about assessment and reassessment, I also need to tell you that on field, please do a prompt assessment once. If you're seeing that the shoulder is coming out of socket, if you see that the ankle is highly unstable, don't keep on doing that. That's going to hamper the mechanism even more. Hence, your wise call at that time is important. Coming back to management, about assessment and reassessment. Now, what is the goal of holistic rehabilitation, right? And what is the role of aquatic therapy? So aquatic therapy has been emerged as a boon, especially for your early phases of rehabilitation. Why? We'll come to it. Before that, let me just tell you that water literally creates magic. Water is magic. Yeah. So it has certain properties that will help you not just for healing, but it will work on your entire body system. Now, when you are in water, there is a buoyancy. That is the upward force of water that is acting on you, right? So when you're around, when there's a neck immersion, your body is almost 90% offloaded, right? So imagine there's hardly any loading force on your joints. First. Second, you have a hydrostatic pressure. That is the pressure given by the water on you. Because of this, you see that there's a lot of increased circulation. There's a lot of lymphatic flow. There's a flow back to your heart. Studies have shown that there's an increased cardiac volume, a good distribution of blood to your muscles. Okay. Water also has the property of viscosity, the drag force. Viscosity can offer a good resistance. A good amount of strengthening can take place using this resistance, and especially the temperature. When those are warm water pools around 32 to 34 degrees Celsius, these temperatures have a good effect on your body, considering the amount of distribution of blood flow. It will extend the pliability of your muscles. It will help you to reduce swelling. Studies have proven that in cases of knee injuries, shoulder injuries, usually you see that there's early reduction of swelling, reduction of pain, reduction of edema, and improved range of motion and muscle strength when the athlete is taken in an aquatic environment. Boon is that we can start rehabilitation really early. I'll show you how it goes. So we are going to recover safer and faster. What I mean by holistic is just not aquatic. What we do here is the athlete is or the client is given aquatic therapy, land therapy, and outdoor training together. So that is a holistic picture that I'm talking about. It's not just aqua. It is aquatic plus your land therapy plus your outdoor therapy. Outdoor therapy is to translate your effects in your function to return back to sports, right? So these things work in conjunction. The dosages vary more or less depending on the condition. However, the slides that I'm going to show you are more towards your athletic rehabilitation. Whenever these things you're not supposed to do by yourself, you need to do a thorough assessment by your surgeon, by your physical therapist, and only then, with that assessment picture, we decide what kind of treatment is to be given in aqua, land, and outdoor. But every person is subjected to all three together. Okay. Now this is stretching taking place in aquatic environment. Results have shown that stretching in the aquatic environment have given much better flexibility and much better results as compared to land therapy, because your warm water pools make the muscle pliability, flexibility better, right? One important thing is that aquacentric, you have hygienic, temperature controlled indoor warm pools, giving you an added benefit for the same. Now, this is a high flow jet that has been coming. So the high flow jet is used to give a deep tissue release inside the water. If you can see the alteration in the skin pattern, right? So the high flow jet will help you giving a deep tissue release inside water. This will help you to break all the adhesions, make the muscles more flexible and more pliable. Now, when it comes to strengthening, all right. Now, if you check this video, the person is wearing flippers. He has to work against the water. Now, flippers is going to increase the resistance. This is giving a good strengthening effect on his hip musculature, on his knee musculature, and ankle musculature. At the same time, focusing on the core, right? And your joints are offloaded. So that's an added advantage. So carefully see, this is how you will add to strengthening. And trust me, it's not easy. Okay. Now, we have underwater ellipticals. Now, when I say that underwater elliptical, this also helps to improvise your cardiovascular and respiratory functions. Okay. When you talk about rehabilitation of an athlete, it means that you have to tap on all the body systems. Okay. It is said that within a period of 2 weeks, for example, an athlete has a ligament injury and the person is supposed to be immobilized, is supposed to be in the brace, non-weight bearing. Non-weight bearing is not touching his leg on the land for a long time. So when that is going to happen, if that is going to happen, the pattern of walking that is going to take place. So ultimately you're supposed to walk, right? Ultimately we want to walk. So the gait pattern, walking is gait. The gait pattern starts getting altering. Your cardiovascular efficiency starts getting reduced. So that is why it is important to consider these things. Now, when you are in water, you can very well work on your cardiovascular and respiratory endurance. It is said that when you're immersed in water, you have a good cardiac output. That is, the blood coming from your heart is sufficient and 50% of it is diverted towards your muscles. There's a good amount of blood flow distribution. There's a good amount of pressure that is coming on your body. So that is why your respiratory muscles are also at challenge. So you have an improvement in your respiratory parameters also. Now, how do we progress with weights? In advanced training, for example, now you have a good strength, good range of motion that has been taken place. I'll just pause here for a while. That have been taken place, and now you need to kind of challenge the athlete even more. So this is the underwater plyometric station. Okay, so there are different color codes of different heights inside the tank. The person is supposed to hold the ball and do the up and down movements against the water. Yeah. What is the benefit in this? Again, when you are in water, your joints are deloaded. In cases of ligament injuries, you can take the athlete if in as good as in 2 to 3 weeks in the water and start training. Okay. Usually it becomes very difficult to start your plyometric training, your gait training, especially that is training of walking on the land, because the athlete is not supposed to weight bear on the leg, right? So because now the gait training cannot happen so quickly on land, the reason is when you're on land, there is a lot of loading forces, especially your body weight that is coming on your knee, that is coming on your joints. In water, because you're deloaded, there are no loading forces that are there on the joints. So it is a safe environment to start your early rehabilitation. You can start walking in water much faster. Advantage being that your pattern of walking is restored. It's restored, your muscle movement, your joint movement is still restored. So if you see this is the gait training. Again, person is made to have a flipper, is supposed to walk in water. Your heel to toe pattern of gait is restored, and you can make the person walk very well in the early rehabilitation phase also. Plus, you can add resistance here. Not in the early phases, maybe later. Once your strength, range of motion is kind of stabilized, it's restored, you can take the person to plyometrics. Plyometrics can start very early in water as compared to land, because plyometrics, what does it involve? Basically, it involves a lot of jumps, a lot of jump squat movements, lot of agility, again adding pressure onto your joints. So till the time plyometrics reach on land, it takes a little while for that. In aquatic, the safest environment, you can start plyometrics and retain your movement patterns much better and much earlier. Okay, so this you can see that the athlete can very well start doing this much earlier in the phases of rehabilitation, thus restoring your movement pattern. Now, this is your advanced plyometrics by giving weight in your hand. That is addition of a challenge. Your core has been challenged, your hip muscles, ankle muscles, knee muscles have been challenged. Here. Now, if you see, there's a lot of turbulence coming here, right? So these pools, basically the pools have something called as trivia, that is, it generates a lot of waves inside the water against which you're supposed to do. It generates turbulence against which you're supposed to do these movements. Advantage being your core is challenged. Talking about core, the minute you're taken in water, the minute you stand vertical, your core starts firing because you don't want to sway, right? Your core starts acting then and there. Core stability, as I said, is at most important in any rehabilitation, in any successful rehabilitation. And trust me, your core is challenged to a larger extent in your aquatic environment. Now, here the person is supposed to hold the ball in between his knees, very stable, stabilize his core, and then do the movements. See how difficult it is to maintain a stable position, and that can only happen when you have a good core. So your core control in aquatic environment gives you a lot of challenge there. Here the person is supposed to hold the noodles and supposed to maintain a balance in 90-90 position with the core tight. This is a roller pin. That's in advanced phases, where now you can kind of stabilize your body. So you add a dynamics here. Now I'm supposed to stabilize my core plus do the downward movement or side to side movement using that roller pin, which constantly is trying to come up. So I'm working a lot on my scapular stability also. Then comes your advanced knee and core. Now here again, against the turbulence, you're supposed to come up and have a core control. This is also challenging your hip knee musculature. Watsu. Now, when I say that in any person, you have to work on all the body systems, right? Watsu is a technique of complete relaxation. Now, these athletes also are, see, once they were playing at a highest level, for example, they had the highest level of their performance, and now due to injury, they're not able to go back. It's going to take some time. So, you know, there's a lot of stress going on. There's a lot of stress there. So, Watsu is a relaxation technique where you are gently floating on water, that the aura, the temperature, the surrounding is maintained very calm, and this gives a whole body relaxation. This is a passive technique. The therapist is supposed to move you. You're just supposed to be floating, lying down on water, and relax yourself completely. Apart from this, you can also do a good mobilization. Now the person is floating, you're supposed to float, and therapist can move your neck, cervical spine, that is your neck. You can move your entire spine. You can mobilize your entire spine. Yes. Also, the advantage of water is reduction of pain. There's a sensory overflow. There's a research that says there's a sensory overflow. It acts on your sensory receptors, and there's a reduced pain perception. So basically, when you're in water, if I'm doing range of motion, if I'm doing strengthening, if I'm mobilizing you, the amount of pain that you're going to perceive is much lesser. Okay, let's see something for shoulder. So this is a noodle. Again, now it can be multiple movements. It can also be behind for scapular stability. This can be designed according to the rehabilitation, according to the condition. Okay. Now, once you're able to do this, then the person is made to lie down in supine. Supine is head facing upwards. Now here the person is activating person is activating core, at the same time doing the hand movements. Well, now that the person can do the previous exercise well, you add weights. Once you add weights, here you see a good amount of core control. Apart from that, you have to challenge your scapular stability. So by doing this, she's trying to approximate your scapular blades, thus challenging your scapular muscles also. Right? Now, then again, as I mentioned previously about the roll-up pin, now the person is doing well in heads-up position. Now the person is taken in prone, and the roll-up pin is given a lot of core activation, a lot of scapular activation, and supposed to work against the weight. Okay. Now, a weight has been given in the hand. Here again, this entire segment, especially your scapula, is supposed to be stable, and then the person is asked to do some hand movements, thus trying to see whether stability can be maintained, challenging the strength and endurance of your scapular muscles. here. Now, if you see, this is a TheraBand tied outside. Okay. And this is your resistance training. Resistance means this is your strength training now taking place. And this can be placed in multiple directions. Now you can start mimicking your actual sport technique, right? But before doing that, you have to run a battery of tests to see whether now your athlete is ready to be exposed to that. And this is a really good exercise, and you can mimic your different sports position and start strengthening in those. Again, your advanced training. Here, if you see carefully, I'll just pause it. These are the waves and turbulence created in the pool against which you're supposed to do the movement. All right? Challenging your core a lot. Okay? The minute you stand in water, you're a little shaky. So you need to stabilize your core. And imagine this high flow, this turbulence that is coming. If you're not stable, it's going to throw you back. So you have to challenge your core here. And with that, do your dynamic movements. Advanced core with shoulder. Here, the person is supposed to lie in prone, that is facing downwards. A ball, buoyant, more buoyant the object is, more lighter it is even difficult to press it downwards. So it takes a lot of strength, stability to kind of take it down. And here you can add multiple permutation combination of the exercises. Flippers are being added now, which is going to increase the resistance even more. Yeah, look at the core stability. There's a lot of hip stability required. Your girdle muscles have to fire. Your shoulder blades have to be extremely stable. Only then you can do this efficient movement. You can have multiple combinations of the movement depending on the condition, depending on what you're going to expose your athlete to. Here comes a greater challenge. We know how difficult it is to do one plank on the land. You literally keep staring at the clock when that 1 minute is going to get over. Trust me, when you're going to do plank in water, it's going to be even more challenging because there are forces that are kind of good. You're offloaded. You're kind of in this floating zone. To maintain yourself very stable in the surface of water, then go in a plank position. Apart from that, add weight and then do the movement with the roller pin. A high activation of core, your pelvic floor, your back muscles, your hip muscles, and your scapular muscles to maintain this position. Again, you can do it in prone position, giving the ball, giving lighter and lighter. There are various aquatic equipments that are there, and those are selected according to your strength, according to your motion. So the combination is selected according to your muscle strength picture as to what you're going to get exposed to. Okay, so now here, this was a picture of your aquatic therapy, right? Pain-free, safer, faster. Incorporate your walking training in the early phase. Pain-free training, reduction in the pain, reduction in the swelling. Pain and swelling are usually your major factors in joints that restrict you to go for higher range of motion, to start walking, to start doing your advanced biometrics. In aquatic environment, you're relatively safe and you're fast. That does not exclude the importance of your land therapy. The athlete, we always give a holistic combination. Land therapy, we all know that You focus on your strength. You do a lot of on-field. Importance of icing on-field is very important. Importance of icing stays long till your swelling is resolved. Then comes important thing, assessment, reassessment. Now, let me tell you something about the missing links that happen in your land therapy. See, all of us are involved, all the athletes are involved in physical training. You're doing good push-ups. Now just see, when I'm doing push-up, the amount of overuse of neck is too much, right? Your scapula has to be really stable to control these movements. So please go to your therapist, assess yourself, and start your scapular endurance, scapular control, core control, and pelvic floor training. These three are vital in any racket sports. So just a gist of scapula. This muscle is extremely important to be trained, your serratus anterior that we call it as. It helps you to stable your scapula very well on the wall. So that's like how we do at Aquacentric. Some insight into the land therapy in your medical therapeutic gymnasium. Core is challenged, person is on unstable surface, weight is given on the hand. Again, sitting on unstable surface, challenging your core, maintaining your movement control. You use Pilates reformer also, highly challenging. Now, again, as I said, whatever training, whatever rehabilitation is there has to be translated into your outdoor. This is the sport-specific training that we give in the outdoor garden, in your ability garden. After we run a battery of tests, we understand where now the athlete has progressed, and we start giving your outdoor training. Again, your sport-specific training, the combinations depend on your conditions. In summary, holistic rehabilitation is the key, guys. Combination of your aquatic, of your land, and your ability garden is very, very, very important. There should be a combination of all three right from the beginning till your last return to sports comes. So hence all these goals are restored once you have a holistic view towards rehabilitation. Ultimately, it needs to translate in function. It needs to translate into the sport that the athlete is supposed to play. So this is a key to a good rehabilitation. Incorporate all the body systems. Don't ignore your cardiovascular endurance because that's going to be a trouble later. Don't ignore your nervous system. You should have a holistic view. Work conditioning, work hardening. What I mean by that is slowly you start creating environment that is sport specific, so that ultimately in hardening, you can take the athlete to the actual environment, start training there and make the person play. So these are the few tips that you can do to prevent your tennis injuries. So at Aquacentric, we have free online consultations going on by our physiotherapists. We have free sessions going on by our physiotherapists. And these are the contact numbers if you wish to avail the benefits of these. So next Wednesday, we have Dr. Arnaz giving us a lecture on common injuries in football. So stay tuned, guys. Thank you. Any questions, you can put it in the comment section.
Thank you, Dr. Nikita. We have got a few questions from our viewers. So our first question is from Mr. Rajesh Mudolkar, who has some concerns with his left shoulder.
Okay.
So he would like to know a few exercises or on what aspect should he concentrate on in the initial stages.
Okay, so that completely depends on the cause of your shoulder pain. So if you are a recreational athlete or a professional athlete, if your shoulder pain is because of your repetitive stress, you kind of first need to physically assess it. You need to see the range of motion, and most probably it's your scapula that might be at, at the picture, at the fault. So you kind of start scapular stability exercise. But if your pain is too much, first make sure that your pain is come down by a good amount of icing, and then you can start with your proper scapular stability exercises. But before designing any exercise, it's important that we do a physical assessment. So maybe connect with your therapist and take a physical assessment. You'll understand the cause of pain, and then you can design your exercises, mostly targeting your serratus anterior, your force couples of the scapula, and gradual range of motion exercises. But start targeting your scapula, and then you're good to go.
Thank you so much, Dr. Nikita. Our last question is from Miss Diva Ganerebal. She has a concern with her elbow, which is hurting. So she would like your help for it.
Sure. So the cause of elbow, is it a traumatic injury or is it because of your overuse? Usually elbow pain, if it's on the outer side, it's because of your constant gripping, constant wrist movement. As I said, it causes a lot of irritation here. So if it is, there are multiple diagnoses of shoulder pain, mostly pointing towards an overuse lateral epicondylitis. But we kind of need to rule out some nerve entrapment also. So you need to see if there is any tingling, any numbness also happening. So you kind of need to rule out that. Otherwise, a good amount of icing and starting with your eccentric training will be the kind of exercise. But again, as I said, anyone, it's very important to first get it physically assessed. Assess it first. Fine, we'll find the cause, we'll rule out few things, and then we can give specific exercises.
Thank you so much, Dr. Nikita. So we end our session. We end our session here. I would also like to inform you all that we at Aquacentric in this time of quarantine are providing free online consultations and group sessions. So please do contact us and avail the services. Thank you so much. Have a lovely week ahead.